Setting up webinar, wait just a moment. Okay, good afternoon, everyone. Thank you for joining us for the live Riley County coronavirus update. Today is Monday, April 6th. Today we'll hear brief statements from Riley County Local Health Officer Julie Gibbs, as well as Riley County Police Department Assistant Director Kurt Muldrip. And today we have an additional guest, the Riley County Police Department Victim Advocate Coordinator, and her name is Melissa Mosher. After their brief statements, we'll have some time for question and answer. So thank you again for joining us, and Julie Gibbs.
All right, thanks, Vivian. Hi, everyone. I know that these last few weeks have been rough, and for many of you, including myself, the month of March may have felt like a whole year. Hung in there so far, and I still see a lot of positive messages floating around on social media, so I appreciate that, and I'm pleased to see that. Please know that we here at the EOC are working hard to be prepared as a community. This includes preparing for an isolation or quarantine site, as well as an alternative care site. We ask that you continue to help us in our preparedness efforts. This is level by level. The first level was closing the schools, which we did on March 13th, and many counties followed shortly after. That was absolutely necessary to prevent exposure and to stop the spread. The next level was the order of prohibiting groups over 10 and to enhance social distancing. And the level after that, of course, was our stay-at-home order, shortly superseded by the governor's stay-at-home order. We discussed over this last weekend that we now have evidence of community spread. This brings us to our next level, which is to be very clear on the governor's order to stay home. Her order is very clear in stating that no other jurisdiction can issue a similar order while hers is in effect. We can do our best to enforce her message. That means we're looking at best practices within businesses, which we've already done. Those that are exempt from that order. We'll also be stronger in our message to not travel if unnecessary. And overall, we will definitely be louder as we shout out to the community to stay home. As of today, Kansas has 845 positives statewide, and that number jumped by 98 since yesterday. Kansas also has 25 deaths overall, and there are now a total of 198 hospitalizations. Riley County now has 14 confirmed positives. 2 cases were found out yesterday during the day, and both are males and both reside in Manhattan. One gentleman who is in his 40s had travel in his history, and the other gentleman is in his 30s, and we are currently in contact with him and his family. A third individual was identified as positive this morning. This man is in his 50s and is currently being isolated at his home in Ogden. More information to come later on all of these individuals. We are monitoring 17 individuals, and 42 individuals have finished their quarantine or isolation period. We have 14 tests pending, and there have been a total of 87 negative tests in the county. We do monitor individuals daily, and many of them have said that they have been symptom-free for a few days now, many of the positives that we've monitored. We can also confirm that 2 of our positives are now fully recovered. We will have these numbers and more listed on our website and updated daily. Please visit rileycountyks.gov and click on the coronavirus link. For general questions, we are encouraging everyone to call our hotline, 785-587-5426, or to email us at rileycountycovid19@gmail.com. We also still have our screening line available at 785-323-6400. If you are experiencing any symptoms, please call that number and the nurse will help direct you to where you need to go. Please stay positive, stay safe, and stay well. Above all, stay home. Now I'll hand it over to Kurt.
Hi there, it's Kurt Muldrip, the Assistant Director at the Riley County Police Department. Today I'm going to take a different approach. I want to talk about gloves. I've noticed that a lot of people are starting to wear gloves as I'm out. And in general, I think that's fine, but it's important for everyone to understand the concept of cross-contamination. If you choose to wear gloves, it's important that you understand this concept because there's no point in wearing gloves if you have cross-contamination. The best way to illustrate this, I think, is while painting. If you wear gloves while painting and you touch the paint, which in this illustration will symbolize the COVID-19 virus, you still get the paint on your glove. Then when you touch your phone, you touch your face, you touch your cart, and then you transfer what's on the surface of that glove to everything you've just touched. And then when you put your phone to your face, you have additional transfer. Imagine getting that paint now on your face. That's cross-contamination, and that's also community spread. That adds to the community spread. So unless you're washing your gloves after you touch something every time, you're still collecting whatever virus or whatever substance is on the surface of the item that you're touching. So the key here is, like we've been saying all along, stay home, leave only for essential functions, and then wash your hands regularly. Or if you're wearing gloves, you really need to wash those gloves regularly. Consequently, the type of glove you wear is going to make a difference. It's hard to wash work gloves, knit gloves that I've seen. The standard surgical or rubber gloves you can wash, but again, the transfer really isn't that it's getting into you from your skin, as you know from the CDC guidelines. It's when you're touching your face and you get it inside of you. And then also continue to maintain social separation of 6 feet. I probably should add, know where your hands are at all times too, what you're touching. I know we've all had that. It's difficult to control our hands. Even as we sit here and do this, we want to touch our face and it's difficult not to. So that's kind of my message today, in hopes that we can slow this community spread. You're muted, Vivian. So now I believe she's saying we're going to have Melissa Mosier with the Riley County Police Department Victims Advocate speak.
Hi, everybody. Thanks for this opportunity to come and speak. On behalf of the Riley County Police Department and Community Services, we did just want to share with the general public that should you find yourself to be a victim of crime during this time of COVID, that there are services that are still open and available to assist you. We do not want victims of crime to be remaining silent. Depending on the service, there may be some community-based services that may want you to try to talk to them over the phone or to have a video chat with them, but everyone is open and ready to serve you. The folks at the Crisis Center still have their shelter open. If you are a member of the Fort Riley community, their Family Advocacy Center and their SHARP office is still open to receiving calls. If you're a student at K-State, the KSU Care Office is still open. A great community resource for those victims that may need to do some emergency safety planning would be our Crisis Stabilization Center with Pawnee Mental Health. As well, Pawnee Mental Health is open and available to take any of requests and services, as well as here at the Riley County Police Department. I'm available here in office every day. If you are in a situation or have been a victim of crime and you would like to know your options and what services are available to you in the community, please feel free to reach out to any of us. We are definitely still here and available to assist our community.
Thank you so much for that, Melissa. I know that people are facing a lot of kind of emotional and mental health challenges during this time when the world is pretty topsy-turvy. Do you have any general advice for people who are experiencing, heightened anxiety, heightened stress during this time?
Sure. As we're contained within our homes, sometimes just having a safe space or just a personal space that if tensions tend to rise, if people are just generally getting upon one another's nerves, that you could take that private time, even in a separate part of the room or another room in general. There has been a lot of information that going outside, even if it's just sitting in your yard or taking a walk around the block, is not only good for our physical health, but a lot of times can be good for clearing our mind and just giving us a break away from the situation. It is very good to still keep in contact with family and friends as much as possible. If you would find yourself in a critical situation, maybe you have a code word for a friend or a family member, that if you were to give that code word, that they would know that maybe they could check in on you or even try to, get assistance on your behalf. But also it's very important that if you feel that you are in danger or you feel that you are needing supports, that either you call us here at the Riley County Police Department for assistance, or you could reach out to some of those emergency type places like the Crisis Center, who is open 24 hours a day and has an emergency hotline, as well as the Pawnee Mental Health Crisis Stabilization Center. They're open 24 hours a day. Someone will take your call. They would be able to assist you if you truly feel that you're in an emergency situation.
Thank you. Thank you so much for providing those resources. We're going to switch gears a little bit. This question is for Julie. If you could provide, I know you walked through kind of the map of actions that have been taken since the disease started. Now that community spread has been indicated for our community, provide a little bit of clarity about, does that change our actions moving forward or the things that we are asking people to do?
Right. So really what we can do now is ramp up our messaging and continue to help those individuals who are reaching out to us and, letting us know about businesses that maybe aren't practicing the best social distancing, things like that. But we really need to stress no unnecessary travel and do not leave your home except for essentials, because we cannot issue a stronger order than what the governor has in place right now. Those are our actions right now.
And if businesses or people in the community are looking for some best practice guidance, where can they find that?
They can find it on our website, rileycountyks.gov. Like I mentioned before, click on the coronavirus link. There's a lot of helpful information there. All of our listed there. So please go there and check out those best practices for businesses.
Julie, this next question is for you as well. When we talk about community spread, the cases that we've been tracking and the people who are in quarantine have followed guidelines. Where might the community spread have come from? Do we have any ideas about that? And is it possible for somebody to have the virus and not know it and not have symptoms?
Sure. So when it comes to community spread, that's when we cannot trace it back to recent travel. So if that person did not travel, and in this case, we have detected that, that is when we know that they got it from the community, and that's what's defined as community spread. So in that case, we have to ramp up our messages to be very aware when you are out, and if you don't need to get out, then don't. And I'm sorry, what was the second part of your question?
Is it possible for somebody to have the disease and not know it and not have any symptoms, but still be able to spread it? Absolutely.
Yep. CDC has just come out with evidence of that people can have this, can be a carrier and not develop any symptoms, or even when they do develop symptoms, they can still carry it when they don't have symptoms. So it's there's evidence of that. And so we need to, again, be aware of that and be aware of your surroundings. Like Kurt mentioned earlier, make sure that you're practicing good hand hygiene.
Do we have any questions from the members of the media who are part of the call?
Yes, this is Savannah Ratanabong with the Manhattan Mercury. I was wondering, do we have any further details about the newest positive case, such as has this person been out in public, and do we know when, where, and generally how they might have contracted the virus?
Sure. So we don't at this time, but we are currently, as I speak, they're doing their disease investigation. We have many people on it right now doing that. So we will have more information shortly.
This is Kaylee McLaughlin with the K-State Collegian. I was wondering if there's any overlap between the pending case number and the monitored individual number.
I'll have to get back to you on that one. I'm not real sure right now.
I believe there is. The pending case number or the people who are being monitored don't include those who have tested positive, but would include those who are pending. So it's not an additional number of people, but those two groups do kind of do have some overlap.
Sorry.
Go ahead. I'm sorry. Please continue.
I was going to say, I know the state stay-at-home order allows outdoor activities provided people maintain the 6 feet distance and the 10 people maximum, but do you think that we could get to a point where those certain outdoor activities are restricted as well, such as like fishing or anything else that people are doing right now?
Yeah, it could be, but right now we just really want to stress that we really need to practice that social distancing, and even when we're outdoors, we've been pretty lenient as far as what we're saying when we go outside, but we need to get stricter on that message, because from what we've seen, there are some people that aren't necessarily following that social distancing. So I don't know if a stricter order would come down from the governor. I would hate it if it did, because I like to enjoy the outdoors as well. But we really need to stress that social distancing even when we're outdoors.
When we talk about social distancing and kind of how the county has scored, Kurt, can you talk about the tools we have for measuring that and how that's been available online?
Yeah, I can't remember. There's a couple websites out there, and I think people have been able to find them through different social media contexts. But I know that the cell phone companies collect the data of cell phones when they're out and about. And I emphasize it's the cell phone companies that do this. It's not a government tracking, but they are able to tell where everybody is as far as how much they're out and about, moving into areas that are open businesses as well as distance apart. And they're using that as a way to kind of grade communities within the United States on how well people are staying at home, how well they're only going to essential businesses, and then maintaining the social distances. And so I think that's a great tool for us to look at as a community. It's open to the public. Anyone can look. And again, I want to emphasize, because I know a lot of people get nervous about that's not related to the government at all. The police department or government entities don't have any more knowledge than you do. That's just information they put out, I think, as a service to the communities to see, how everybody's doing, and then they grade it. And I couldn't tell you what their scale of grading is. I think they've gone with percentages of the decreased activity. And last I saw, we were at a B, which is pretty good, but we would like an A.
Mm-hmm. And I did kind of set you up for that one, because we have a link to that information on the Riley County coronavirus website. That's Riley County, oh goodness, I'm going to get it wrong. RileyCountyKS.gov/coronavirus. And we are at a B. Julie, we've had a few questions coming in about testing guidelines and who is eligible to get tested, who should get tested. Can you speak to that a little bit, please?
As of right now, we have to be careful who we test. The guidelines from KDHE are pretty strict as far as who we can test. So we have our screening line, and we do have those nurses that will ask you a series of questions. But hopefully here before long, we will, you've probably heard rapid tests coming down from KDHE. I know that they're going first to the counties that need them the most, but hopefully before long, we'll be able to test more people. But right now we do have to follow those guidelines about who can get tested.
Thank you. Do we have any other questions from the media at this time?
Yeah, what is the median age of those with positive cases in Riley County right now?
In Riley County, it's 39. And that looks different from the state. I believe right now at the state, it's 50s, 60s. I just glanced at it before this, but yeah, we're a little younger age than the state.
I know the EOC is planning to set up this alternative care space for quarantine and isolation purposes. Are you guys expecting to only use that if there's a surge in the area, or do you plan to use it kind of as cases come in?
We'll use it for many different reasons, and we'll just kind of see what the situation looks like. But one of the categories is for individuals who may need to be quarantined, especially if we have first responders or healthcare workers that may need to be quarantined and they don't want to go home to expose their family. So that would be one criteria. We'd put them there, and it would be a 14-day stay. So yeah, there's many different criterias of individuals that would fit that need.
And just for a little clarity, the name is actually alternate care site, not alternative. Okay, finally, I know the CDC has come out with some updated guidance regarding the wearing and making of cloth masks. Are medical providers able to use those? Can you provide some guidance about who and when people should consider wearing cloth masks?
Right, so this would be for the community. We did get some new CDC guidance on Friday for the community to wear those cloth masks. So there's actually information on our Facebook page, really video on how to make those. They're really simple. So in the event that you're not going to be able to maintain social distancing, that's when you would want to wear a cloth mask. So you'd be able to make those in your own home. And again, that might be when you're going to the grocery store or somewhere where you might not be able to maintain that social distancing.
And I'll add to that we're currently working with a local church that will become a kind of a collection point for those that want to make. We've had calls about a lot of people wanting to make them and donate them, as well as requests for them. So we're coordinating and should have good information on how that'll be set up here shortly. But it'll be a place where people can drop off masks as well as go get them if they're in need of masks. And I'm going to be that glove guy again with the masks. I think it's important for everyone to remember too, those need to be cleaned regularly. As you breathe out or breathe in, if that collects any of the virus or anything else that you're breathing, it stays there. So keep that in mind when you're taking it off. Don't stick it in your pocket and save it for later. It needs to be washed. Just like we're washing our hands regularly, wash those masks regularly. They're going to be up on your face.
It's very good advice. Thank you. One final question. I know I keep saying that, but is it possible? Do we know yet if it's possible for someone who tested positive to get the virus again?
We don't
even
believe
after they've
so.
recovered? Okay.
Right. We don't believe so because they built up those that antibodies. We don't believe that that's possible this time.
Okay. Thank you so much for joining us. Are there any final questions from the media? Not seeing anything. We will have a broadcast again tomorrow, also at 4:15 and every day except Sunday. If you have questions, we ask that you either leave them in the comments here on the Facebook page, or you can also email rileycountycovid19@gmail.com. Specifically, if you have questions about businesses or best practices, any of those things, please use that Gmail account to email and get your questions answered. Thank you. And remember, stay home, stay safe.